Hello, I'm Davina Gordon, and I'm the new marketing manager for the Eckenberg Institute of Pelvic and Sexual Pain. Dr. Robert Eckenberg is a pioneer in treating chronic pelvic pain, and we are calling on you, his many patients that he has helped and saved from a debilitating life of pain and desperation, to become advocates for his unique model of care. We have set up a new and private Facebook group, the Eckenberg Institute Pelvic Pain Community. The group will be self governed by patients of Dr. Eckenberg. It will be your group. So please join via the QR code and share your stories, and together we can help change the lives of millions of people living with chronic pain. Collaboration is fundamental to increasing awareness and making change happen. Together, we can dial down pain. So please join and be part of an incredible movement the world of medicine needs. Let's create Dr. Eckenberg's legacy. Thank you.
My biggest interest over the last number of years was to help create some center of excellence at some point, somewhere, to be able to tell people, well, they have my records, they have the record of everything that we've talked about and all the treatments that we have done. I haven't talked about the treatments that I do, but treatments are pretty easy to teach. They're very, very non-invasive. It's a totally office-based type of practice.
Yeah.
And I can teach nurse practitioners and physician assistants and other types of non-specialist doctors to do the small amounts of injections that we do strategically placed just under the skin
Yeah.
and bladder treatments that we do in the office. I can teach other than super specialists how to do those things. So people ask me, what am I going to do when you're not here? And even this morning, I was talking to two patients before we set up this appointment here with you, in people that I haven't seen in 6 months. And I'm hardly doing anything for them anymore. We're carrying on a little bit of medication, and they know that I'm here. And both of them asked me, when are you going to retire? And what am I going to do when you're not here? And I think to myself, I'm really not doing that much, but I'm like the little um, pill uh, box in your medicine chest that is there in case you need it,
Yeah.
because they don't know who else to talk to if they have a flare of any of these issues. So I'm really trying to develop through this social media a group of my patients, which will be as you said, I think we're calling it the Dial It Down group,
Yeah.
whatever it is. I'm not an expert in Facebook. I'm just from a different generation, but I know that Facebook hits as many people as possible.
Yeah.
So what we want to do is have a private group that actually helps me uh, pass forward what they have experienced. So I have people of huge divergent population of patients. And we currently have emails of over 1,000 complex pelvic pain patients that range from doctors and lawyers and engineers and business people, as well as people who work in factories and are trying to keep it together with disability and so forth. All levels of sociocultural backgrounds, all very divergent population, and they have so many talents themselves. And I want to tap that talent because what they all have in common is that they have experienced our model of care.
Yeah.
And I want that force, that leverage, so to speak, of a group of people who have that in common from around the world, really, from many countries and all over North America, and in many different levels of care and interests that they have, and use that talent in one way or another to pass forward their interest in seeing that others are able to get this kind of care into the future.
Yeah.
It's not going to be a support group directly for people to call and find out what do I do about this problem or that problem,
Mhm.
but it will help create, I'm hoping, centers of excellence by a very, very talented group of people that now understand what their problems are and why they're having them and how they improved with and we have really good data now showing how well things have done for most of our patients. There's a paper coming out from a research center in Canada that has looked at our overall results of our care and our practice, and statistically put it together, and soon will be available on a open source medical journal that people will be able to find out exactly, what the outcomes are. It's not just me broadcasting that I'm a good doctor and it's not being done elsewhere, but I'm constantly amazed that it isn't more interest in training more people like myself. And so I think it's, somewhat of a failure when I look at why do people from Europe have to get hold of me? Why do people from South America have to get hold of me? Why does somebody that is only 5 miles away have to get hold of me through the internet because the doctors that they're going to are not allowed to refer outside of their system? So all kinds of obstacles that people run into when they try to seek help. So we are available still, and I'm going to keep on continuing seeing patients and doing what I can as much as I can do online, which is a lot easier at my age. But I still see people twice a week in my office for treatments. And
Yeah.
as I said before, I can train someone else, and I do have developing interest in a few people trying to figure out how to learn how to do that. And I hope to be able to work in partnership with them and gain some ability to have, okay, all of my patients, here is who you can follow up with, and you don't have to start from scratch and explaining what your problems are.